Hi everybody, Dr. Eric Plasker here, and welcome to 100-Year Lifestyle TV. I am here with Dr. Alan Nathan's family chiropractor, Jacksonville, Florida. Thanks for joining us today.
Thanks for having me.
Tell us about...
I was just in the neighborhood.
Just in the neighborhood. So you're with me in Atlanta, but really we're here to talk about you in Jacksonville because you've been in that community now for how long?
16 years.
And what's it like serving the community of Jacksonville with chiropractic care?
I have a great time, and one of the reasons why I have such a good time is because people are hungry for chiropractic. And so one of the things that separates us actually is, and I've heard this from other people, because when people come into our office, a lot of times what they'll say is nobody's ever looked at me the way you're looking at me. You know, they'll say things like, nobody's ever used this technology to see how my nervous system was actually working. I've only been adjusted. Lay me on a table and adjust me. So that's one of the big reasons, you know, why we're doing such a good job, is because we're looking at people from the inside out and showing them how to live a healthier, active lifestyle.
You know, I think that's important. You talked about looking at people from the inside out. You talked about looking at them differently. I think that what people don't understand, and you say people are looking for chiropractic care, they're really looking for, and maybe if you're watching this for the first time, you're probably looking to be healthy. Maybe you're looking for a way to get healthy without taking a lot of medication, and maybe live an active, healthy, long life, not just feel better for the moment. When you look at people as a human being and you see them not just as a symptom or an ache or a pain, what do you see? What is your vision for a patient that walks into your practice?
My vision is to be able to help them live an active, healthy lifestyle for as many years as God's going to give them. And what I see so often is that people are living like they're going to be 60 or 70 years old, and they're not preparing for the 80, 90, 100 that could actually be coming. And I see that all the time. I mean, I have a dad that's 92 years old. He's about to turn 93. So I've seen what's happened with him and how he hasn't prepared. He hasn't prepared financially, he hasn't prepared physically, and he's not prepared emotionally to keep living. And so now he's in a nursing home. And so that's kind of one of the driving factors for me, to be able to help other people.
Yeah, we say a lot in the 100-Year Lifestyle that we're the first generation in history that's getting the advance notice that whether we like it or not, want to or not, we're probably going to live longer than we ever thought. I know that in Jacksonville, like in many other communities around the country, that you have assisted living centers that are popping up all over the place, that families are moving their parents and grandparents closer so they can take care of them. What is it that you think that individuals who are being faced with these aging parents, what can they do differently, and how important is a healthy spine and nervous system in being able to function well, not just for today, but throughout your entire lifetime?
The first thing is just is a mindset. It's if I'm the person that is 50, 60 years old and I'm planning, or even younger, and I realize that people around me are living a long time, then I've got to do things. I've got to do things to prepare for that, because it just doesn't happen automatically. What happens automatically if you do nothing is usually the worst case scenario. So if you're not prepared for the 80, 90, 100 years, you're setting yourself up for a failure. And
you say doing nothing, and the reality it is for many people is they're doing something, even if it's covering up symptoms with a medication or a drug or something that may be causing side effects or contribute to deterioration down the road, as opposed to...
I don't think people realize that if they were to start to understand that how the body actually works, you know, how does your body work? And so in our office, what we do is we show them how their body works. Instead of looking at you and saying, okay, you have low back pain, you know, let's go down there and adjust the spine. Maybe the problem's really in your neck. Maybe the problem has to do with the way you're sleeping. Maybe the problem has to do with what you're eating. Maybe the problem has to do with who you're hanging around with. You know, what you put in your mind, what you're looking at. So there's a lot of factors that play into somebody's ability to live their life without limits for 80, 90, 100 years.
Yeah, well said. And you know, and you mentioned a lot of other factors that I think people are addressing in many different ways, or trying to address, whether it's nutrition or diet or something like that. But at the core of it, in so many ways, as you and I know, studying this for so many years, is the importance of a healthy nervous system.
Right.
Talk about why that is so important and why so many people overlook it.
When I tell a parent who's pregnant, are you thinking of bringing your child in? This baby that you're growing. What's going to happen? You've seen other kids come in here. You're in here all the time, and you see all these kids. Are you going to bring your kid in and let me check your kid for subluxation? Sometimes they say yes, and then sometimes they say, well, why would I do that? So sometimes it falls on me where I didn't actually educate them well enough, but other times it's like they truly don't know what to do. And so it's up to us as their chiropractor, and in some cases as their primary care provider, to be able to show them, when your child is born, it's much easier to take care of a child and to grow a healthy child from the time that they're born through every stage of growth and development than it is to fix a damaged adult. And
True.
That's what we do.
Yeah.
That's what we do in our office, but they don't hear that anywhere else. And so the chiropractor truly can be, in a lot of cases, the primary care provider.
Well, I think in most cases, and certainly many of your patients are in your practice, and they should be, and all of you should be if you haven't made an appointment to go and get checked, have your nervous system checked, and your lifestyle evaluated by Dr. Alan Nathans. It would be a great idea for you to do that. Any final thoughts for somebody that may be considering coming to see you with their family?
Sure. If you've been thinking about it, or you decided that you want to come in to get checked, you should come into our office and let us show you how your nervous system's actually functioning. We do really, really simple, non-invasive, computerized nervous system scans that can help you identify and show you exactly where the nerve interference is. There's no questions. Once you see it, you can't deny it anymore. Then you're left with the decision of what are you going to do about it. And so we're here to help you, and we'd love to be able to do that.
Yeah, and don't wait till you're 80, 90, and 100 years and having to deal with the consequences of not doing it after you watch this video. So, so thanks for all your work, for your commitment to your community. We appreciate the stand that you're taking and the people that you're serving. And thanks for watching, everybody. Dr. Alan Nathans, go check it out.